Good evening, my name is Giselle, and this is my audience for my informative speech. Good evening, my name is Giselle Aponte, and my informative speech tonight will be on genetic testing. What's in your genes? What is genetic testing? Genetic testing is an examining of a blood sample or other bodily fluid or tissue for biochemical, chromosomal, or genetic markers. It's used to guide prevention, diagnosis, and treatment of a disease. There are two major types of genetic tests performed in the United States. The first one is prenatal testing, which consists of genetic testing during pregnancy. The two major types of genetic testing during pregnancy consist of amniocentesis, which is a procedure in which the needle is used to extract amniotic fluid from around the fetus. And it's usually performed within 16 to 18 weeks within the pregnant woman. Chronic villus sampling is the second genetic testing done in pregnancy. It's a small piece of placenta that's removed to check for genetic problems in the fetus and is usually performed within 10 to 12 weeks of pregnancy. The second major genetic testing in the United States is predictive and presymptomatic testing. These tests find genetic variations that increase a person's chance of developing specific diseases. Some of these diseases include Duchenne muscular dystrophy, also known as DMD, sickle cell anemia, Alzheimer's disease, cerebrovascular disease, also known as stroke, Huntington's disease, and multiple sclerosis. When do doctors recommend genetic testing? If a close relative has inherited a disease, a couple who has a child with a severe birth defect, women who have 2 or more miscarriages, women who have delivered a stillborn child with physical signs of genetic illness, pregnant women over the age of 34, a child who has medical problems that might be genetic, or a child that has medical problems that are recognized as specific genetic syndrome. Implications of testing. Like every other test, there are benefits, limitations, and risks. Some of the benefits include a positive result. The benefit of a positive result is so that you can have early detection and know that you do carry or you have inherited the disease gene, and you can start making lifestyle changes as far as treatment. A negative result could mean a sense of relief for you and your family member to know that you do not carry that disease gene. What are the limitations? There is not a test for every disease. There are about 1,000 different tests that are available. However, there are more than 1,000 different diseases. And what are the risks? Because most of these genetic tests are done by a blood sample, there are no physical risks. However, there are psychological risks. Knowing that you do carry a disease gene can lead to a lot of depression and anger. Facts to know. Over 1,000 tests are available to determine disease genes. It is not regulated by the FDA because it is considered a service, and it's usually not covered by your insurances. Now, the reliability and accuracy depend on the analytical and clinical validity. Analytic validity is is when the test consistently gets the right answer as to whether a specific gene mutation is present or absent. Clinical validity is when the test result correlates with the presence or absence of a specific disease or heightened risk of disease in a patient. The following slides are just some of these diseases that these genetic tests can determine. The first one are children with Down syndrome. The second one is a baby with cleft lip and palate. The third one is an older woman with Alzheimer's disease. We also have a picture of sickle cell anemia, which is odd-shaped red blood cells. And then we have a young gentleman with the Duchenne muscular dystrophy, also known as DMD. As far as references, if you want more information, the following websites were used to retrieve information for this presentation. You can go to www.kidshealth.org, www.caregiver.org, and www.nlm.nih.gov. And all the pictures were taken from google.com. Do we have any questions? I would like to thank you for your time. You all have a great evening.